For aftercare, I wanted to talk on this slide about what happens immediately after the baby's born. So this should be the most joyful time. We initially recommend what we call delayed cord clamping. So once the baby is delivered, we like to not clamp the cord, but let it naturally pulse so that the majority of the blood will go back to the baby. And we usually do this between 30 and 60 seconds. At that time, we will clamp the cord and we'll offer your support person to see if they want to cut the cord, which they may opt or not opt to do. At this time, your nurses and your care team will also be assigning APGAR scores to the baby, and they may weigh the baby as well. Most patients are able to initiate skin to skin at this point. This is where your baby is laying on your chest. Skin to skin has great health benefits for you and the baby. It helps stabilizes their temperature, it helps with their breathing, it helps your breast milk to come in and to establish breastfeeding. Sometimes a patient can't undergo immediate skin to skin. For example, if the baby needs evaluation by the pediatric team, or if in a rare case, baby has to go to the NICU, or if you're having a C-section and the doctor's finishing up your surgery. I want you to know that nothing is lost because as soon as you and your baby are ready, you can initiate skin to skin. Your care team will also recommend a vitamin K injection to allow for blood to clot normally and prevent bleeding, as well as an antibiotic eye ointment to prevent an eye infection. They will obtain consent with you before doing this for the baby. A lot is going on, as you can see at this time. But while you're focusing on baby, your doctor will also be repairing lacerations, assessing and managing bleeding, and finishing a C-section in that case as well. You can expect to spend about anywhere 1 to 3 hours in your room or your post-op area before transferring to the postpartum floor. Once on the postpartum floor, you'll have very educated nurses who can help you with incision care, perineal care, and pain control, and lactation support from both your nurses as well as lactation specialists who I think are like baby whisperers. They are wonderful. My advice in this stage is use your resources while in the hospital. Get rest and enjoy the snuggles.
All right, so now we're going to switch gears and talk about caring for your baby. And we're going to start with talking about breast and bottle feeding. So newborn babies, they feed on demand. That's typically on average about every 2 to 3 hours. Some babies can cluster feed where they want to feed every hour. And in the beginning, especially, babies can be pretty sleepy. So you may need to wake them up to feed. And if you find that your baby is sleeping and it's been 3.5 hours, it's recommended to wake them up so that they can feed. So how do you know if your baby is hungry? There's different feeding cues you can look for. Having the baby smack their lips together, they may put their hands in their mouth, they may make a sucking motion with their mouth. There's a normal baby reflex called rooting, where if you stroke the baby's cheek, they'll turn their head to that side and open their mouth, showing that they're ready to feed. Also, crying and fussing in general, that could be a cue that your baby's hungry. If you're interested in breastfeeding, this should be started right away. So, as Julianne mentioned, in the hospital, right after the baby's born, you could have the baby come on your chest and you could start having them try to latch to breastfeed. It's very normal in the beginning not to produce very much breast milk. In the beginning, there is this thick, yellow, very nutrient-rich substance called colostrum that's produced, and that is in small quantities, and that over the coming days will increase into the more what you picture as traditional milk, the white, more thin milk. So again, very normal not to produce a lot of milk in the beginning, and this will slowly increase over the first couple of days. That's why it's super important to let your body and to let your breasts know that you need to keep producing milk. So we recommend having the baby latch at least every 3 hours to help stimulate the milk production. If for some reason there's any issues with latching, that would be a reason to reach out to a lactation consultant. So lactation consultants are amazing. They should be available in the hospital right after the baby's born. They can work with you with positioning, with holding the baby, figuring out what a latch even means. And then they're also available in the outpatient setting. So many of them will do virtual visits, and they'll even come to your house within that first week too. So lactation consultants are amazing. What are some of the benefits of breastfeeding? Well, when you breastfeed, the mom passes on antibodies to the baby, which helps with immune protection. So this can help prevent your baby from getting sick. Benefits to baby also include decreased rates of allergy, decreased rates of asthma. Benefits to the mom include decreased rates of breast cancer and ovarian cancer. And it's great in general just to have the baby have that emotional support and to bond with you. However, if for whatever reason you can't breastfeed, you're not interested in breastfeeding, it's just not for you, that is completely, completely okay. It is totally fine to give your baby a bottle with either pumped breast milk or with formula. So if you do choose to give your baby a bottle, you can either give them pumped breast milk, which you can talk with the lactation consultant more about, how to pump the milk, or you can give them formula. The most common formula brands available in the hospital are Enfamil and Similac, but there's so many brands out there, and all of them are great options. Some popular ones include Bobby, Kendamil, but all of them are great. And typically with the bottle, in the first day or so, babies tend to take maybe about an ounce per feed. Over the next couple of days, they'll probably increase to about 2 ounces per feed. After, a week or so, they'll do maybe 3 ounces per feed. But there's no one size fits all with feeding. Every baby is different. So looking for your baby's hunger cues that I mentioned above, that's how you're going to know if your baby's hungry. So now moving on to sleep. So newborn babies should sleep in a crib or in a bassinet. They're recommended to be in the parent's room for the first 6 months of life, just because, as I mentioned before, you're going to be feeding them pretty frequently. They're going to need diaper changes. So it's helpful to have them close by to you in your room. It's super important for babies to always, always, always sleep on their back. So this is the safest way to prevent SIDS, which is sudden infant death syndrome. So always put your baby on their back. It's very normal when you put the baby on the back. Sometimes they will almost like roll over onto their side. That's okay. Just make sure you put them down on their back and never on their stomach. It's okay to use a swaddle to wrap your baby nice and cozy like you see this baby in the picture. There's also a lot of great sleep sacks available that you can zip the baby into and then Velcro their arms to have them nice and tight and snug. And if you think about it, your baby was snuggled up in your body for 9 months, so they want to be snuggled once they're outside the womb as well. And in the crib, we don't want any fluffy blankets, stuffed animals, pillows, only your baby swaddled nicely on their back in the crib. And the AAP, which is the American Academy of Pediatrics, does not recommend co-sleeping. This is having your infant in your bed with you, as this also increases the risk of SIDS. And one other thing about sleep, about babies sleeping, which I never really realized until I had my own daughter, babies are really, really noisy sleepers. So they can flail their legs around, they make little cooey, grunty noises, and they're pretty loud when they sleep. This is normal, so don't be alarmed by it. But if there's any concerns, you can always ask your pediatrician about it too.